Well, it was over 2 years ago. I missed my time over in Europe, especially over in Switzerland. I enjoyed several days in Bern. I got to meet some very spectacular, very intelligent people. And one of those I met while over there was Dr. Christoph Buerki. He was one of the pioneers who helped design and implement the Swiss heroin injection program. Now, he's no longer specifically involved in that project, but he certainly knows a lot about it, and perhaps has some advice he can share with U.S. authorities with change in mind, because there is change afoot here in the U.S., Dr. Buerki. There are those who are calling for safe injection sites where people can use drugs safely without overdosing and dying, which seems to be a huge problem here in these United States.
Yeah, I'm aware of the how it goes in the United States.
And I first off, just want to thank you for being with us.
You're quite welcome.
Yeah, Dr. Buerki, when you and your associates began the Swiss heroin injection program, well, I believe that was in 1998, if I'm correct. What was the situation like then, as far as drug use?
Actually, you have to go a bit before. It was in the 80s already when we had quite an epidemic of drug use among young people, with open drug scenes, like in the city of Bern. You know, it's the federal capital. Was like at times it was all around the Capitol building, the federal parliament building, this open drug scene. So it was quite difficult also from a public order point of view. And the whole process basically towards those four columns, four pillars of Swiss drug policy, it started in the late 80s with the safe injection room. We had the first safe injection room in Bern, Switzerland, where we didn't talk about heroin prescription yet, but we just or my predecessors in that area, they just thought we need to prevent those horrible overdose deaths by providing a safe environment. As you're aware, how the concept goes. And they had that at the beginning, small project, and later on it became bigger and bigger. And that's basically when I was a freshly graduated doctor, when I started working there in the early 90s. So we have a tradition of harm reduction measures in Switzerland, and heroin prescription, which only came later on, 96, 97. 98, it was established as a regular treatment in the narcotics law. It's only a continuation of a process of thought where you try to minimize harm for people who happen to, at this stage in their life, do illegal drugs, heroin, consume heroin, and of course are always at the risk of overdosing.
Yes. Now, we have in these United States a very horrible scenario at this point. We have people who are addicted to opiates. We have traffickers who are unable to import or export, however you want to say it, to get the drugs to the sellers in the regular quantities and qualities that perhaps they were heretofore been able to do. And so now we always had contaminated drugs, but heroin was already not heroin. It was fentanyl becoming carfentanil. And now it's even worse that because of the COVID-19, there are even more nebulous concoctions being created and sold, and the death toll is rising even further. The latest stats I have for 2018 was a total of 67,367 overdose deaths, with 40% of them being for opioids only. What is it like in Switzerland? What are the overdose deaths there, sir?
Well, we're talking about a much smaller scale, of course. The phase I was talking about in the early 90s, we had 500 to 600 overdose deaths a year. And it was considered a huge failure of public health.
Yes.
And okay, we are 6 million. I mean, it's 50 times, 20 times less than your country. But still, it was already considered a big problem.
Yes.
And nowadays, it's below 200 people dying of overdose
And
every year.
if I may submit or interject the thought that of those couple of hundred maybe, none of them are dying in the heroin injection facilities, are they?
At least in my time until early 2011, 2012, there was never ever somebody dying in an injection room. We did have occasional situations where somebody was really in bad health. I mean, you see those people twice a day. You can observe them. You see when they're getting a fever, a shiver, when they maybe have endocarditis or something, and then you can send them to hospital. And of course, it happens that somebody like that also dies.
Right.
But never ever did somebody die of an overdose death in a safe injection room or a heroin prescription site.
Now, when I was there, you made arrangements for me to take a tour of one of the heroin facilities. A young lady, I'm sorry, I can't recall her name, was kind enough to take me to every floor to show me every step of the process, how the paperwork was done, how it was done carefully, how it was done in such a way as to protect the individual at every step of the way. And I guess what I'm seeking from you, Dr. Buerki, is some advice. You know, I feel privileged. I got to go over there. I got to meet you, Dr. Zhao Gu Lao, others who have stood boldly, who have brought forward new ideas, new means of protecting the individual. And we in the United States have this recalcitrant party. I'll start there, that just refuses to delve into, to examine, to study, to find out the truth of this matter. They live in the past and they refuse to make any changes for fear of something horrible happening. And with nearly 70,000 overdose deaths, I don't know what they're afraid of. Your response to that?
Yeah. What could be worse than 70,000 people dying every year? Huh? That's the thing. Actually, I can only tell you how we did it. And we did, I think the most important thing was that there was a public awareness of the problem. I'm not informed if there is that public awareness, but the drama and the horrible things that are behind those open drug scenes were very well visible in Switzerland, since my town, city of Bern, 200,000 inhabitants, is a small town. It was visible for everyone. There was crime related to those open drug scenes. There were up to 1,000 people like there around the federal building. That was visible for press people, for politicians, as well as for the general public. And as a consequence, it was mainly the city governments of several big cities who said we need to try something different. So they were the initiators of this, and they met with a by the way, conservative federal counselor who was responsible for this department, and he was quite open to the idea to do it as a trial. Not at all a definite treatment or something, but just let's try it. Let's try if it's feasible, if it helps people, if it helps reduce crime. So on the one side, we clinicians, we did the treatment. And on the other side, there was a whole research group really thoroughly evaluating the whole thing, not in a double-blind setting, as you would, of course, to be very rigorously evaluating it, you would need to have a double-blind setting. It was later done in other countries. But just very strongly observing, how are people doing? How are they improving? Are they improving, or are they all dying? Yeah. And that was made by a very respectable professor at the time, who was already retired and had this as a long-term project. Well, and he could really show that that people improved a lot. Sub research showed that criminality, delinquency improved a lot. Concomitant cocaine use. I mean, there was also always the issue. Many people consume heroin and cocaine at the same time in Switzerland, and we only prescribed for the heroin. Was it possible to also cut out the cocaine? We didn't know, but we also made the observation that many people can succeed in cutting down or cutting it fully out their cocaine use as well.
Well, that is wonderful. And your point being that it was the local officials who had a more firsthand awareness, observation of what was going on in their community, and wanted to do something for their community. Whereas, and it's similar here in the United States, where local county, city officials want to make these changes, but they're constrained by state and federal law, which in many cases absolutely forbids them from doing what it is the help they want to provide. Your response there, Dr. Buerki.
How do you convince a conservative politician in a federal structure? Here it worked because it was very visible even to him. I would have no idea how you could do this. Maybe you need to change the government, sorry to say.
Okay. And you mentioned Switzerland has a population, did you say 6 million?
Yeah.
That's what we have basically in my hometown, Houston, Harris County, within about a 50-mile radius of downtown. There's about 6 million people. And we here in this city, the district attorney, the sheriff, the police chief, are all striving to make these changes. And as I indicated, having to do battle against the state, in particular, the governor and the lieutenant governor who live in the 1880s, I believe.
That was actually also one part. We did manage, everyone involved in the project managed to get into a real good collaboration with the police. And they started really to appreciate what we were doing. It went as far as that at one point, just a little anecdote, they brought some patient had done something illegal and he was arrested by the police, and then he was really nervous because he would have to get his shot of heroin, and so 2 policemen came along with him, stood in line and had him make his injection, so they would have quiet time to examine him and to talk to him about the committed crime. That was so illustrative how we sort of collaborated together.
And the good news is there are cities, Ithaca, New York, and of course Seattle and San Francisco, and there's even some rumbling right here in my city of Houston about the need for a safe injection facility. And truth be told, Dr. Buerki, in most of America, or in huge portions of America, I haven't analyzed it that finitely, but there are no needle exchange programs. The people are still using dirty needles, sharing dirty needles, and getting more diseases and infections and just horrible complications that come from such a scenario. Your thought, your advice to those politicians who are denying this to their citizens.
I mean, it's sometimes difficult to talk about this because it is so essential. It's so essential, and it has been proven by so many studies all over the world that syringe and needle exchange, it's just the basic. I mean, you do not stop anyone from not providing him with clean needles, but you generate a whole lot of problems if you don't provide it. If you have them reuse needles, hepatitis C, HIV are some of them are treatable diseases if you're well insured. In your country, this is not the case for everyone, I hear. Here it is. Every drug addict has a health insurance, but it costs like so much money to treat hepatitis C, to treat HIV. For the rest of your life, you need to take those thousands of dollars a year cocktails. It also, from an economic point, it just makes so much sense. at least to do the basic things like needle exchange, needle syringe exchange, as well as provide a safer environment for people to inject their own drugs, if they inject or smoke their drugs, if they smoke.
Now,
And then maybe one thing, the heroin prescription is maybe not the basis. I don't know. The basis should still be, in my eyes, methadone maintenance treatment should be available for everyone. Nowadays we have with oral morphine provided as a substitution treatment, as addiction treatment, not as pain treatment, but as addiction treatment. Right. We have also good alternatives that many people could profit. Well, so it doesn't always need to be heroin prescription. That's what I want to say.
Sure. A buddy of mine says, well, why not just make big balls of opium available? It's a much less deadly concoction, if you want to call it that. Yep. And it actually allows people to titrate their dose, to use just the right amount without overdoing it. It seems, in Colombia, Bolivia, they have coca everywhere. Not very few people are doing cocaine in those countries, but nearly everybody is chewing a little bit of coca to absorb more oxygen at those high altitudes. And it's a bit of pleasurable to take as well. But it doesn't always have to be. I remember the story that when Bayer invented heroin back about 1900, it was sold on the grocer's shelf right next to Bayer aspirin at the very same price. And it just seems like there are better ways if we just think a little further. Am I right?
One thing I think is very important also to note to your earlier remarks about fentanyl, cutting heroin with whatever. It's the unpredictability for a drug addicted person to predict what's the effect of what I'm taking. Yeah. And that is very, very, very dangerous. We did those analysis just with heroin in the street injection room. We asked people to give us a little amount of what they are injecting, and we did find concentrations between 3-4% of heroin up to 70 or higher percent of heroin. And that is so dangerous. That is so dangerous, this change of concentration. So you get used to sort of, it's always a visual decision to take that much. And then suddenly this is like 7, 8, 10, 15 times as strong as the last batch. That is very dangerous. So with heroin prescription, of course, you have that problem you don't have.
No, you do not. Now, you're a psychiatrist, am I?
Yes, that's correct. Right? Yeah.
And I know it's hard to do this type of analysis and projection, but and perhaps you might have to be a bit facetious with your answer, to be honest. But given that here in the United States in particular, we believe, there are many people who believe in drug war, who think it's a necessary item, who treat it almost as if it were a religion, just so very necessary to life on this planet. And yet they have never examined the truth. They have lived by propaganda and hysteria handed down from grandpa to daddy to them, that they've never read a study. They've never talked to doctors like you. They just carry this belief system within, and that helps to control and perpetuate this war on drugs and the misery that flows along with it. How do we deal with the psyche of the people who believe in this drug war despite any indications that it has a true benefit? How do we deal with those folks?
I can only tell you how we did it or how we tried to do it. We tried to do research, to talk again and again and again about the results of the research. Also have addicted people talk to the press, for example, to give their point of view. And for example, there was a big fear at the beginning of heroin prescription that we did, was that it will sort of idealize heroin. It will make heroin much more popular if you can just go to the doctor and get it there. But then again, the total opposite was the case. Uh, I mean, who would want to take a drug where you have to go to a doctor, to a polyclinic twice a day to inject it in a totally exactly defined, supervised way? A nurse standing next to you when you do the injection. You have only 7 minutes because the next person is waiting, and so on. In reality, this is totally unattractive for a young person. And what happened? Heroin, it's not at all fashionable to take heroin anymore in Switzerland.
Right.
I mean, heroin today is a loser drug. If somebody starts with heroin, all his peers go, "Oh, what do you do? Heroin? You crazy?"
Well,
That's what we want. That's a good effect, you know.
yeah.
We don't want to promote heroin. We want to treat people in the most adequate way who have a heroin problem.
Now, I think about when I was in Switzerland, I enjoyed the beautiful scenery. I got a chance to look across at the Alps from one of your parks there in Bern. It was just a beautiful afternoon. I talked to people. They said, "What are you doing here? You're America. What's going on?" I told them, I'm trying to learn more to help America stop its addiction to drug war. And I think that is what we have, is these people who do not want to face the years of horror, the overdose deaths, the diseases we talked about, the empowerment of terrorists, cartels, and gangs. They just don't want to face that they were wrong decades ago and that they're still wrong now. I guess what I'm trying to say here is that President Trump, he's wishy-washy. He speaks good and bad. He doesn't, he has an opioid commission, but they don't really seem to be doing much. Joe Biden in the 80s and 90s was very instrumental in crafting and exacerbating our nation's drug laws, mandatory minimums, 3 strikes you're out, all of this stuff. And they don't seem like particularly good candidates for making a change. But I feel that it is my hope that this video you're helping us work on, this seeking the moral high ground, that it may gain some traction, that they may have to listen if the major press will help support this effort, if they will help to show that we have been on the wrong track for these many years. I guess I'm preaching here. I'm not even asking a question.
No. It does look, to me as an outside observer, it does sometimes look a little bit like a holy war that your politicians are leading against drug addicts.
Yeah.
Against drug addicts. And that's a bit sad to see. In many ways, we did once have an Iranian delegation coming to Switzerland, and in some aspects they were quite open to what we did and quite interested also because they also have an opium problem there, and they were quite open. So I still do hope that your holy warriors will sort of slow down a little bit and be open to arguments, to ethics also. It has to do with ethics. What do we do with our young people, or not so young people, doesn't matter. Well, it has to do with ethics.
Yeah, yes, sir. And to me, it really boils down to what is moral about the drug war. It's a hope. It's a dream. Someday we will stop kids. No one will ever do these drugs again. There won't be any overdose deaths. Children won't have access. But in the U.S., and we've led this drug war across the world, truly, through the United Nations, through funding to various nations that you either get on board with the drug war or we're not going to fund you this year. And that has helped to expand and, as I said, exacerbate this problem. It is, the U.S. owns this, the central plank of this platform of drug prohibition. We own it, do we not?
You also have many initiatives, many people. I mean, 20 years ago already, somebody visited me from Chicago, and he had a needle exchange program somewhere. And it wasn't in Chicago, but then near. And during the talking with him, he took his phone and said, "Oh, now my of my collaborators has just been arrested again because for distributing clean needles." But still, you have many people who are or parental organizations of parents who have lost their child and so on. So you just need to listen to those people as well.
Yeah.
I'm not so pessimistic. I think there's a lot of good-spirited people in the US also.
Well, and look, I couldn't be doing this after 20 plus years if I wasn't an optimist as well.
Yeah,
I
yeah,
think you know that.
yeah.
Well, Dr. Buerki, I guess we're going to wrap it up, but I just want to thank you. I really do, for taking time to speak with us and to help to educate hopefully a few Americans, to the possibility, the benefits of changing our ways and means of, quote, waging this drug war. Your closing thoughts, sir.
um, I appeal to you. You don't need to find the big solution. Nobody has the big solution to the problem of drug addiction. I mean, it's horrible if somebody you know well is addicted to a drug. There is no cheap solutions, but there is, as a society, ways we can try. We need to try it. Maybe you won't succeed. I don't know what's the tailored solution or way to go for you and your culture, but try it. We did try it. Switzerland is a conservative country, um, however, quite rich country, and we tried something and it worked. It wasn't the solution for every public health, public order addiction problem in our country, but it was a very important step. And the same could go for you, for your country. Try it in a small project, prove that it's feasible, that it's efficient to do, that it works, and then learn from it and develop it.
Thank you, sir.